Hey, this is Charmin from OT Concept, and the one that's barking, that's Fuji. Fuji's here too, so it's nice out. So I figured to video while out here. It's a little bit chilly, of course. So when you think about when you think of occupational therapy or OT, what comes to mind? Although the name itself includes the word occupation, our expertise doesn't involve helping people find employment. And while therapy is found within the title of occupational or physical therapy, we're not interchangeable either. So instead, both professions play their part. And because this is often confusing, it's crucial for us OTs or occupational therapists to educate the public on who we are and what we do and how occupational therapy can fit in their recovery. So today we'll explore this further, and by the end of this blog, my aim is to make clear why occupational therapy is possibly right for you. So now, let's crush some or a few myths. So myth number one, occupational therapy only caters to senior members of society. So not true. In this profession, we'll actually work across the broad age spectrum, and this means that we can help from premature babies to seniors and everything else in between, including kids, teenagers, middle-aged adults. And with children, our aim is to assist individuals who have sensory, cognitive problems, and of course, physical ailments. And then keep in mind that the goal of therapy is to help patients gain independence to the best of their ability. Therefore, we'll desire this outcome not just for seniors, but it's equally important for newborns, teenagers, middle-aged adults, working class adults, or so myth number two, physical therapists do the same thing. Yes and no. So yes, that we both seek to improve a patient's life, and both disciplines will offer healing assistance to patients. However, their expertise falls into two different categories. Their objective is different. Physical therapists aim to treat a patient's specific impairment from a biomechanical position or approach, focusing on the body movements as well as physical function. With occupational therapy, however, we seek to help each patient function as independent as possible within their environment. And with successful treatment, the end result is one that helps patients conduct their daily activities with independence. So what makes occupational therapy so vital is that until your life experiences a debilitating problem, it's difficult to imagine a normal activity like brushing your teeth or combing your hair or shaving can be challenging. I have a lot of patients telling me that they have taken their arms and hands for granted. Many have abused their hands so much, especially now that we've been working on our computers a lot, and that when something happens and as simple and mundane as brushing your teeth, it's hard to do and sometimes almost impossible. So many have told me, I don't think my hands, many people have told me this, that quote, I didn't think my hands that way before, being important until this happened to me. So myth number three, occupational therapists have limited experience with children. So occupational therapy is incredibly useful and well-versed in improving the well-being of children with special needs. So for example, whenever a child experiences developmental delays, the likelihood is that the child will require support throughout different stages of their lives. And we can create a customized approach best suited for the child in question. And occupational therapists have the expertise to understand the different stages of development, and this plays a valuable role when we're engaging with various disorders, and this becomes important as children transition from one stage of life to the next. So we collaborate with different doctors and parents and educators to improve child's life, and we can also recommend different sensory strategies or activities to address the child's specific needs. So since each person will have different needs, we will not ask you to adjust to occupational therapy. Instead, a customized or individualized therapy is crafted specifically to meet your needs. So we cater to patients, hindered by arthritis, Alzheimer's disease, diabetes, sprain, spinal cord injury, stroke, fractures, surgeries, surgeries such as tendon repairs, ligament damage, behavioral issues, joint replacements, birth defects, ADHD, and that's just scratching the surface. We can help so much more. Although I can, bust countless of other myths, the takeaway is that I'm here to help you return to your daily activities as independently as possible. So you can share this blog to your family and friends to help them get the help that they need. You can also follow us on Facebook. You can also subscribe in my YouTube to receive the latest tips and blogs. Like us on Facebook, follow us on Instagram, and also if you have any questions or concerns, or any topic that you want me to specifically talk about, you can text us or call us or email us at charmin@otconcept.com. Okay, see you soon.